Hi. Pregnant women and their unborn fetus are being threatened today by an uncertainty without a cure or treatment. The threat? Zika virus. It has the potential of becoming an international pandemic, according to both the World Health Organization as well as the Centers for Disease Control. On February 1st, 2016, the World Health Organization declared the increasing cases of neonatal neurological disorders, microcephaly, and Guillain-Barré syndrome have been linked to the growing Zika virus outbreak in the Americas. They have coined it a public health emergency of international concern. Dr. Margaret Chan, the head of the World Health Organization, indicates that the virus is likely to spread explosively before a vaccine is developed to prevent its infection. Also, there are currently no available antiviral medications to treat it once infected. Researchers with the Centers for Disease Control report that 1 in every 100 women that are infected with the Zika virus during their first trimester will give birth to an infant with microcephaly. The Center for Disease Control also reported in September 2015 that there was a sharp increase in the number of reported cases of microcephaly in the areas mostly affected by the outbreak of the virus. As of February 2016, still no vaccination available for its prevention. The Center for Disease Control goes on to indicate further that prevention measures are the primary focus of care. Those center around protecting oneself from mosquito bites by reducing environmental exposure, as well as by using EPA-approved safe and effective insect repellents that contain DEET or picaridin. They are also advising pregnant women to postpone or avoid travel to areas where the Zika virus is active. Those areas include South and Central America, the Caribbean, Mexico, and Puerto Rico. The World Health Organization also agrees with the CDC and that no antiviral medication is currently available to cure the infected. They simply suggest symptomatic management or supportive care if someone were to become infected, namely pregnant women. In February 2016, Baylor College of Medicine sent a flyer to local healthcare organizations which outlines medical management of suspected Zika virus exposure in pregnant patients. It includes a first-line laboratory testing, a second-line diagnostic screening for symptoms, and a third-line, more in-depth study such as serial ultrasounds, amniocentesis, and follow-up continuously with antenatal testing. But again, the best defense is still focused on prevention. Also, the best focus is on education. Educate patients, educate the public. The risks involved of the virus, if the pregnant woman is infected and passes it on to her unborn fetus, represents a definite emergency. The process of finding an appropriate vaccination or an effective vaccination or an antiviral medication to treat the illness is likely a decade or more away. That's according to both the World Health Organization as well as the Center for Disease Control. Extensive research continues. The threat of exposure and risk also continues. The children of tomorrow are facing a tragic threat of uncertainty of today. The Zika virus, it is silent. It is a threat. It is existent. Now I'm going to turn to my visual aid. And the visual aid I have obtained from the website of financialexpress.com. And they have obtained their information from both the World Health Organization as well as the Center for Disease Control to outline a basic fact sheet about some of the most important facts of Zika virus, such as a brief on Zika virus about the risk involved, also of some of the areas that Zika virus is currently active and most infecting, and symptoms of being exposed to the Zika virus, which are very similar to the common cold. And also information about basic transmission. Again, this is obtained from the Financial Express website on the Zika virus, from PTI Graphics, and they have obtained their information from both the World Health Organization as well as the Center for Disease Control to compile a basic fact sheet. Thank you. And if you have any questions, please call the CDC website, or, log on to the CDC website at cdc.gov. Thank you.